Hello, this is Dr. Gay from First Lake MRI, and this is a patient who is 53. She injured her knee skiing recently, and she tore her ACL, unfortunately. Her ACL is a ligament right here in the central part of the knee, but the reason I'm showing this case is because another pathology, this is off on the medial side of the knee. There's a complex fluid collection. Over here, the fluid is really bright, so this is a complex fluid collection with these little streaks of scarring or septations within it, and it hugs this medial joint line and it overlies this little triangle. This triangle is the medial meniscus. So this is the lateral meniscus, looking just perfect. Nice dark uniform meniscus here, fitting between the femur and tibia down below. On this side, the meniscus looks a little bit different. It's foggy over here, kind of expanded, and if we go backwards, we see this horizontal tear within the substance. It looks like the tear goes right into this fluid collection. So this is what we call a parameniscal cyst. It's fluid that weeps out of this tear, and instead of contacting the top of the meniscus or the bottom where it would just leak into the joint, we wouldn't see the fluid. Here it leaks off to the periphery, the rim, and when it gets out here, it'll accumulate into this cyst. So this is again called a parameniscal cyst associated with, in this case, a horizontal intersubstance type tear of the meniscus. This is an axial view where you see the kneecap towards the front. There's a kneecap. This is the back, and along the medial side here we see the cyst that's hugging that medial meniscus. One last image here. This is a side view. You can see the medial meniscus, the front of it. Here's the back of it. Again, it looks like a triangle. We see that linear band in it. That's that horizontal intersubstance type tear. It doesn't definitely contact the top or bottom, but it does come over here and communicate with this parameniscal cyst. And when you see these, the surgeon may want to go in there and take down the cyst and also repair the meniscus, because if they don't repair the meniscus, it just weep out into another cyst. So that's it, a parameniscal cyst of the medial joint line associated with an intrasubstance horizontal tear of the medial meniscus.